In this video training, we discuss how you can go about turning your practice into a contact lens institution. Contact lenses as a whole have created a wonderful avenue for your business to grow beyond its normal competency when it comes to clinical capacity. However, many practitioners still rely on general practitioner care that is managed with a simple pair of spectacles, right? If you're looking for an immediate, innovative way or strategies that you can reposition your practice into a contact lens driven one without compromising your spectacle side of the business, then this video training is for you. The current approach to contact lenses, perhaps with the majority of optometric practice, or let me say with some optometric practices, could be somehow as follows. There's a sign that says contact lens practitioner that you have at the door. You have waiting for patients for approach whereby you're waiting for patients to ask about contact lenses, then you can then tell them about the contact lenses, right? Or perhaps you're getting referrals from colleagues who know you to be a specialist of some sort with regards to contact lenses. Possible displays or display area within your practice or various point of sale materials that you have throughout the practice could be your approach to contact lenses currently. Or perhaps the location of your practice is playing a significant role in your practice selling contact lenses. Perhaps you are in an urban area where the majority of consumers within that community wear contact lenses. Or you decided to grow your practice to one that focuses on specialty practices. There's a lot of people that do scleral lenses that solve various difficult contact lens cases, and so they are known to be specialists or doing specialty contact lenses. Or you just don't see the business value in contact lenses as compared to spectacle side of the business. Your target market is not necessarily interested in contact lenses. Perhaps it's because of where your contact lens or where your practice is located. You never really had a vision for building a contact lens practice. Or there's a difficulty in stocking or lack of understanding as to how to stock for contact lenses. So these challenges that are identified, we can somehow summarize them as follows. There is one, diagnostic efficiency or proficiency. What do we mean by that? Examination procedures not contact lens focused, case history limitations, focusing on basic lenses only. That could be something that you are doing. Not seeing contact lenses as a viable management solution, whether on its own or in conjunction with contact lens spectacles. Not investing adequately enough on contact lenses. Perhaps the challenge could be associated with the equipment. The type you have determines the extent to which contact lenses will work for you or not. Too many professionals bypassing the process involved with regard to the type of equipment that they need in order to get started with contact lenses. Perhaps you have budget constraints, and that's why you don't have the necessary equipment you need in order to provide efficient care when it comes to contact lenses. 3, it could perhaps be aftercare protocols, too much chair time required, not adequately discussing procedures involved with contact lenses from the onset with patients, not benchmarking your practice protocols as part of the entire process. Maybe you've got poor follow-up structures in place or protocols in place, clearly not understanding the ordering patterns or that take place regarding contact lenses within your practice. Number 4, is it maybe a pricing issue that you're dealing with? The business value of contact lenses sometimes is misunderstood by a lot of practitioners. Not having a clear financial target in place, revenue growth strategies not in place regarding contact lenses, or lack of confidence in introducing pricing around contact lenses. Number 5, this is an interesting one. Inability to access market or not knowing how to do so. Perhaps you have poor working relationships with the contact lens companies within your area, inadequate product or competency training that you have. You're thinking, I don't have fit sets, so I can't get started with contact lenses. You're thinking you need stock on hand in order to get going with contact lenses. Opening of supplier accounts might be a difficult or challenging process for you. or you've got a preferred brand usage and is providing an inconvenience for you within your area or community. Number 6, contact lens knowledge inadequate due to lack of practical experience that you might have. Limited contact lens knowledge, knowledge limited to basic optometric practice only, thinking it is too late to start with specialty lenses, thinking your current consumer database will not buy into contact lenses. The above that we've just mentioned simply gives us a snapshot of where you might be within the contact lens matrix as a whole. And so with this background knowledge that we now have described to you, what is the way forward? Well, it's very simple actually. It starts off with consumer profiling. And consumer profiling in terms of generation types. And we'll break it down with the different generation types, looking specifically at the patient, the customer, and the client. So for example, the pre-depression, the patient, perhaps they've got refractive surgery that they've had, right? Or the customer, scleral lens in a 60-year-old lady with 6/120 vision. Client, they know the history, and so you need to treat them with tender love and care. So these are your older patients, and you're thinking perhaps I might not necessarily have the know-how or the skills required to fit them with contact lenses. You'll be surprised at how many of these patients who are your pre-depression or your depression, your silent generation basically, who have had that refractive surgery, they already come with a script from the specialist, or you've got a close working relationship with the eye care specialist in your area. And so they already know what's going on with their eye, and contact lenses could be a way for them to have their vision corrected, for them to see better than they currently see. And so respect is king with this generation. If it is clear you know what you're doing, they will trust you more. And whatever that you say to them, they will go with it. So are you perhaps missing out on an opportunity with regards these targeted consumers because you're not fitting specialty contact lenses to them? You're thinking that they've got elasticity issues with their eyes. Contact lenses are going to keep popping out, but not realizing that at the same time, this individual hates wearing a pair of spectacles. And so they prolong their time to come and get their new pair of spectacles. But if you invested the time in educating and training them and training their caregivers with regards contact lenses, you'll be surprised at how many of them will end up actually wearing contact lenses, and how easy it is once you have built up that confidence and taken time to educate them. They can actually be good to actually put them on contact lenses. Let's look at maybe baby boomers. They have their minds made up that contact lenses are not for them, right? That's the baby boomer, the patient who you already wanting to introduce contact lenses to them, but they already have preconceived ideas about, contact lenses, I'm too old for that. Demonstrate the benefits and address the misconception of sticking a lens within their eye. Make it practical. Let them watch a video of someone of their age group putting in a contact lens. So if it's, let me ask you a simple question. How many taxi drivers are part of the baby boomer generation? Have you ever seen them with glasses? No. Have you ever seen them with contact lenses? Of course they're not wearing contact lenses. So why are you telling them, hey, you can't see clearly. I know you don't want to wear glasses because no taxi driver wears glasses. Let's put you in contact lenses. Me, contact lenses, never. I won't do that. I'll just be fine with reading glasses only. But sir, you need them. You're -2. You can't see when you're driving. So let me show you how simple it is. Here's a video of someone your age group who you think you would never be wearing contact lenses, but here they are wearing contact lenses. Show them a video of a big rugby guy who desperately needs contact lenses, and they play rugby with contact lenses in their eye. So if that big guy with big thumbs is putting a contact lenses in their eye, surely the taxi driver can also do the same. And then you highlight to them and you indicate to them the various hygienic protocols that are in play that they need to be aware of, that they need to adhere to pertaining to contact lenses. And so with regards to customers who are baby boomers, upgrade potential very high on lens wear as a whole. The value and benefits of what they are getting is very, very important. And so just educate them and show them. If you can demonstrate someone who's like them, who is on contact lenses, the more likelihood that they too would consider getting contact lenses. But clients go the extra mile with them to get the solutions that they need, prioritize the chair time. They can't afford to keep coming back to the practice for the same thing. So they already want the solution to be working immediately. So you're already having that to deal with regards introducing contact lenses to someone who has been coming to your practice for the last couple of years, who is a client. Now you want to introduce contact lenses to them. Just always be remembering that with a baby boomer, they want something that will work immediately. So get going. Don't do as much as you possibly can on that visitation that they are there on. Generation X, here, presbyopic opportunities. Get them on the right products from the onset. Our responsibility is actually always with every single patient who is a Generation X with regards to presbyopia. Why are you giving the most basic multifocal pair of spectacles? So if you're already doing that, it means you're going to end up not even giving them contact lenses. But if you start them with the best becomes normal to them, because they would not know any other way other than the best. So always keep that in mind. And they need convincing on what the management solutions will be. So very reluctant to spend money on what they need. But if you have convinced them and you have shown them and you've demonstrated how it will benefit them, Generation X will do very well with regards contact lenses. Some of them, funny enough, they are open to it because of their lifestyle and their leisure activities. Generation X will actually benefit quite greatly with regards having a pair of contact lenses being stuck in their eye. They can be, if you think of the customer, can be introduced to multiple management solutions and will spend money if they are satisfied with their overall experience in your practice. So that's how you can get the Generation X customer onto contact lenses. If you have proven that before, that which you have always recommended for them has worked, now when you're introducing contact lenses, they have to trust that, wait a minute, this person always had my best interests at heart or in hand. So if that worked before and I trusted them, let me give them a chance and trust them again, and let's see how this will work. That's all you need to do. If you have established trust between yourself and the customer who is a Generation X, it becomes easier for them to go with what you're recommending. And or with regards to Generation X, never wait for them to sort of like always, who has been wearing contact lenses, never wait for them to get in touch with you pertaining to their contact lens orders. You be on the ball. You reach out to them first. You are the one who communicates when they're placing their order, following up in terms of do they still have enough. You know this is a client who's always traveling come the festival time. Get in touch with them a month before to say, hey, are you traveling this year? You want us to place your order in advance for you and have your solutions readily available as well. You know, reach out to them way before they need to reach out to you. Then if you think of your millennials, they want to be treated specially and prioritized. They will go with whatever contact lens solution you recommend is for them, for as long as they know someone else that was assisted that very same way. They value sort of like knowing that, oh, they're not the only one, even though they want special treatment. So convenience with regards customers who are millennials, convenience is the biggest issue. Focus a great amount of your management discussions on the impact on the lifestyles contact lenses will have. Upgrade potential on current management solutions is very, very high. They always want new things. So look for the opportunity for the from the information that you have that you can provide to them. So probe them with as much information as you possibly can so that you can then make the necessary recommendations pertaining to the products and the solutions that are readily available. And contact lenses is one good way of you having an opportunity to introducing to millennials, because they always want new things. Generation X or Generation Z actually make contact lenses trend within your business. Why? The management solution must coincide with the trend. So it has to be something that it's trendy, it's in season, it's fashionable. If they know, if through your social media you communicate in contact lenses, they can connect with that. And if they know that, wait a minute, A lot of people actually wear contact lenses, and contact lenses is not something that I thought it was. They're more open to then going with that because it fits within their look. And always with the millennials, Gen X, and Gen Z, contact lenses is not a separate thing. You have to introduce it when you're introducing the spectacles. So with how we're recommending you introducing contact lenses from the onset, the management solutions include multiple pairs of spectacles and contact lenses. That's how it is. Multiple pairs of spectacles and contact lenses. Multiple pairs of spectacles and contact lenses. Multiple pairs of spectacles and contact lenses. And then let's add on sunglasses, prescription sunglasses, multiple pairs of prescription sunglasses. Why are people walking around with one pair of shades? That is completely unacceptable. It's unacceptable. They need to have multiple pairs of prescription sunglasses, multiple pairs of prescription spectacles. That's how it works. Do it from the onset. Do it right. Why are you waiting for people to come to your practice every 2 years? People should be buying from your practice every 3 to 6 months because every new product, new eyewear and so forth, and you're introducing that every single time. And so always remember with Gen Z, it is about how the contact lens make them feel about themselves. And so always understand that it's how they feel. And so consumer profiling in terms of market segment, the business landscape has changed over the last couple of years. How? Well, regarding contact lenses, it is not enough to be a contact lens expert and think that you don't need to advertise, market, brand yourself as per the current and future business requirements and trends. If you don't expand your product, service, and solutions offering as a whole, your business will become stagnant over time. That is a fact. What brought you this far in terms of your expertise is not sustainable to get you to the next level. You have to look at specific needs per target market that you need to make sure that you are communicating effectively with your different consumers. So for example, high income earners, they always have this guilt-free consumption. They require customization, convenience. They're very relational, and understand what drives them, what pushes them, what makes them make decisions. Whereas middle income earners, they prefer customization and recognition. They are on your Instagram. They're very brand conscious. So when you introducing contact lenses, have an awareness of who you're communicating with. And the less affluent earners, they prioritize their immediate needs. They worry about money, right? So the money does not last them for long. It lasts them for what they need now. So they buy in small quantities. Don't plan ahead, right? That's the problem that they have. So they're always looking at what will they be losing versus what will they be gaining. So one of the things that's very, very important with all these different types of individuals is that don't let the circumstances people are in influence what management solutions are best suited for them. With every single consumer, it's very important that you introduce contact lenses to them from the onset. One, you are introducing a pair of spectacles. And so some behavioral strategies that you can employ or implement, the current approach versus required approach. Current approach, it's all about selling contact lenses, but the required approach is providing a scope of visual care and management. That's what you specialize in. The current approach is you go in with what the individual can afford versus you go with what their eyes need. And if their eyes need spectacles, contact lenses, sunglasses, that's what they need. You need to be communicating that. Contact lenses are an add-on to, that's the current approach, versus what you should actually be approaching it is contact lenses are an integral part of the management solution. Current approach, be like everyone else and continue with basic optometry that you're going about your business, or you're upskilling yourself so that you're saying, wait a minute, let me learn about specialty contact lenses. Let me learn about different ways in which I can help my community, and where do I start? And how do I introduce contact lenses to my consumers? What pricing changes do I need to make? So you need to take a step back and understand that how you currently have your practice structured might require you to change it. Sales strategy, basically what we recommend is The ideal strategy is examination procedures is very key from the onset, right, with the patient. Why don't you start with dailies from the onset? Put a daily in their eye. Why are you not doing that? Introduce dailies from the onset. Whereas the customer who has been wearing glasses, upgrade them to a pair of spectacles and contact lenses. Let them try it on. It's very, very important. If you can't do with dailies, next best option is monthlies. But let them have an awareness of the dailies. And sometimes it's better to have a person try on a product, especially a person who is very reluctant to get the product, to use the product, to buy the product. It's not, does it really cost you a lot to have someone try on something, like especially contact lenses, for them to potentially be spending an extra 1,000 rands on a box of contact lenses? But you are limiting your sales to just giving them spectacles, not realizing that, wait a minute, I'm communicating contact lenses with out of the 10 consumers that I'm seeing per day, I'm communicating with all 10, and 3 of them are going with what I'm recommending for them. Over time, that becomes the norm in the practice, to a point whereby even the team starts speaking contact lenses, spectacles, sunglasses with the consumers as part of the management solutions that are available. That becomes the standard. Currently, you're not getting those extra 3 people leaving with all 3 because you're not talking about it, you're not introducing it. So for me, it's just a matter of you starting to communicate, speaking about contact lenses with every single consumer, but not as an additional product, but as part of the main product that the person needs to see clearly. And so your marketing communication strategy, this involves the following: vision. Establish what your vision is with regards to contact lenses. Develop clear strategies to build this vision on. Understand why you need to grow your contact lens side of the practice. Targets: be clear on the different target audiences you provide services to and how you will target each one. What strategies are important to each target audience need to be clear, and what products are applicable to the different target audiences. So if you need to have fit sets readily available in the practice so that you've got your customers that you're going to start communicating contact lenses to, and you want to, when they're already there for their eye appointment, to be putting contact lenses on their eye. If you need to move your examination time and increase your pricing so that you're including your costs as well in that, do so. But those are opportunities for you to grow your sales. Your messaging: what is your primary versus your secondary messaging? What internal and external messaging should your business start to employ? So you need to communicate with your team in terms of what do you want your team to be saying to the consumer? What do you want your consumers to do with the information that you're providing them with? And tactics: what do you need to do to get started with contact lenses? Is start with contact lenses. And so very, very important that you also include contact lenses as part of your social media and new marketing initiatives that you need to implement. And if you need training from the various contact lens companies, get the necessary training. But the thing is, turning your practice into a contact lens institution is very much possible through thorough understanding and implementation of the following: analysis of what type of practice you have versus what type of practice you want to have. Doing a SWOT analysis. And so that category placement of your consumers helps you to understand which consumers you are able to start the conversation with in terms of, hey, you've been coming here wearing spectacles for some time, but would you be interested in contact lenses? Nah, contact lenses won't work for me. To put something in my eye, let me make it simple for you. Let me put the contact lens in your eye and let's see how it goes. I'm not going to charge you for it right now. Let's just put the contact lens in your eye. Let it be something that you consider, and let's take it from there. Then next, consumer profiling strategy. So have clear strategies in place for the different targeted audiences that come to your practice. Next, implementation of a plan of action regarding the behavioral strategies we alluded to earlier on. And so it's very simple. You're either going to do it or you're not going to do it. But going forward, you cannot sit and be comfortable and be complacent with thinking that your practice will thrive going forward. still only doing that which you have always been doing. You have to look at different innovative ways in which you can elevate and accelerate your management solutions approach with regards to the consumer.